Hello guys, welcome back to the channel. It's Unit 7 Part G. Multiple pregnancy. If there is a formation of more than one fetus at a time, then that is multiple pregnancy. If there is a formation of two fetus, that is twins. 3 indicates triples, 4 quadruples, 5 quintuples. Let's see the classifications of twins. In this we have two main types, that is binovascular twins, univascular twins. In binovascular twins, in the one cycle we have two ovaries and two sperms get fertilized and two eggs form, two babies get formed. That is binovascular. But in univascular, one egg will be formed but two sperms get fertiled in it, and in further development this one ovary get divided into two and two baby is formed. That is univascular. In binovascular, the sex of the baby is generally different. But in univascular, the sex of the baby having same sex is the common thing seen in the univascular. But in some conditions, it might be boy and girl. But generally in univascular, the baby will be either boy or girl. Unovascular twins has few terms: monochorionic, diamniotic monochorionic, diamniotic dichorionic. So here chorionic indicates placenta, amniotic indicates amniotic sac, the bag surrounding the baby. So the first condition is monochorionic. Both babies are connected to one placenta, that is monochorionic. And diamniotic monochorionic is nothing but monochorionic, that is one placenta but they have two baby sac, that is diamniotic monochorionic. And next we have diamniotic dichorionic, two placenta with two amniotic sac. This is the three conditions that is seen in unovascular twin. If for example at the formation of baby, the baby is not separated, the egg is not separated, they are joined, the conjoined twins are known as Siamese twins. This is the classifications of twins. The cause for the multiple pregnancy can be many: the food pattern, the environment, the lifestyle, if they are using any kind of hormonal tablet, those things, use of drug and alcohol, everything can be the cause of multiple pregnancy, and sometimes the cause is not known. Diagnosis is very simple. During the pregnancy, the routine checkup will be performed. In that routine checkup, we perform sonography. By using sonography, we will get to know what is the position of twins and how the twins are, what type of twin is present. Everything we will get to know. Based on that, the treatment will be provided. Complication of multiple pregnancy. In this condition, if you see, the chance of getting hypertension and other kind of underlying conditions like diabetes mellitus is increased here. In the multiple pregnancy, the chance of getting hypertension and diabetes mellitus is quite common. If there is a chance of getting hypertension, then do remember the cardiovascular system is also in danger. Apart from this, because of this hypertension and diabetes mellitus, the healing power of the body will get reduced. So, the postpartum bleeding will be increased. The postpartum duration will be increased in this multiple pregnancy stage. Since there is two babies or more than two babies, mother can't provide enough amount of blood to the baby. In this condition, anemic is quite commonly seen. Apart from this, preterm birth, that is before 9 months, the birth of the baby may occur. And the last thing is, it's very important, that is when there is two baby is growing in the womb, one baby grows very well, very healthy, whereas other baby doesn't grow so much good, because only one baby absorb all the nutrition, all the blood supply nutrition, everything, while other baby lacks in it. This condition is known as twin to twin transfusion syndrome. This is quite commonly seen in twins baby. One baby will be very healthy and while other baby will be very low in health. These are the complications of multiple pregnancy. These are the questions that may occur for the exam. It may come, may not come, but do practice well. Do like the video and support me. Meet you in the next video. Until then, stay tuned. Bye.